Management of vertical malocclusion, open bite. The open bite represents a condition where a space exists between the occlusal or incisal surface of maxillary and mandibular teeth in the buccal or anterior segment in centric occlusion. That means when there is an open bite, there is a gap or negative overbite between the lower and upper incisor or maxillary and mandibular incisors, and this gap or space between the upper and lower is called an open bite. The open bite classified according to its etiology into a skeletal open bite and dental open bite. In addition, the open bite, according to the location of the open bite, either anterior open bite or posterior open bite, or a combination of the anterior and posterior open bite. Most of the cases of skeletal open bite are characterized by combination of anterior and posterior cross open bite. For the posterior open bite, some cases have a unilateral posterior open bite or bilateral posterior open bite. The skeletal open bite are characterized by increase in the anterior vertical dimension of the anterior facial height, in addition to the decrease in the posterior facial height, and the decrease in the posterior facial height is either due to the short ramus, and the short ramus causing the rotation of the mandible in a clockwise position and causing an anterior open bite. In addition to the skeletal open bite characterized by increase in the gonial angle of the mandible, and the increase in the gonial angle of the mandible causing an anterior and posterior skeletal open bite in these cases. The skeletal open bite clinically characterized by incompetent lips, and the incompetent lips due to the rotation of the mandible in a clockwise position, in addition to the increase in the gonial angle of the mandible. For most cases of the skeletal open bite, there is an increase in the Frankfurt mandibular angle, the increasing in the Frankfurt mandibular angle causing an anterior skeletal open bite. In addition to the most cases of the skeletal open bite have anterior and posterior open bite in these skeletal cases. In cases of dental deep bite, the most etiological factor not in the skeletal pattern or the gonial angle of the mandible or the Frankfurt mandibular angles. But here, the most etiological factor of the dental open bite is either the bad habits or tongue thrust or mouth breathing. In cases of bad habits such as the thumb sucking, nail biting, pen biting, in this case, mostly the open bite is asymmetrical anterior open bite. While in case of the tongue thrusting here, whether the tongue thrusting is endogenous or adaptive tongue thrusting, mostly the anterior open bite is symmetrical. In the mouth breathing, the mouth breather patient characterized by narrowing of the maxilla due to obstruction of the nasal breathing and most of breathing from the mouth, the constriction in the maxilla causing the flaring of the anterior teeth anteriorly and causing an anterior open bite. Here you have a video demonstration how the tongue thrusting is associated with the anterior open bite, and how the anterior open bite causing an increase in the anterior open bite. For the management of an open bite, most of cases with dental open bite, the habit breaking appliance is the appliance of choice for correction of dental open bite, because the habit breaking or habit breakers are used for eliminating the etiological factor that causing the open bite. In this case, we're using an anterior tongue grip as this in this picture, and this tongue grip is attached either to a removable orthodontic appliance or cemented to a fixed orthodontic appliance as in this picture. The tongue grip is act as a habit breaker, prevent the tongue from thrusting anteriorly and causing an anterior open bite. In cases of posterior open bite due to the lateral thrusting of the tongue and causing the posterior open bite or the lateral posterior open bite, the same tongue grip here put laterally and prevent the tongue from effect on the teeth and eliminating the tongue as a causative factor for the lateral posterior open bite, and in this case the open bite will be corrected by fixed or removable appliance, and in some cases the open bite will correct it without appliance, just eliminating the causative factor by the habit breaker. The tongue grip also can used as a habit breaker, prevent the thumb from reaching to the palate and eliminating the causative factor or breaking the habit of the child or the patient. And in this case, when the habit is breaked by the tongue grip or habit breaker, here the patient can correct it spontaneously without needing for any mechanic for correction the dental open bite. The management of the skeletal open bite either by using of hypal headgear, and the hypal headgear will act on the posterior molars. Here the hypal headgear is connected to the Adam's clasp of the removable orthodontic appliance on a tubes on the bridge of Adam's clasp and causing intrusion of the maxillary molars, and the intrusion of the maxillary molars will correcting the anterior open bite by causing the rotation of the mandible and anti-clockwise and correcting the anterior open bite. Most of the cases of the skeletal open bite should not corrected by extrusion of the anterior teeth, because the extrusion of the anterior teeth will be a relapse after removing of the appliance, in addition to the formation sometime gummy smile due to the extrusion of the anterior teeth as an attempt to correct the anterior open bite. So the correction of skeletal anterior open bite is mostly by intrusion of the posterior molars to correct the anterior open bite, the skeletal anterior open bite. In addition, the other appliance used for the correction of the skeletal anterior open bite, use of the mini screws or tads. The mini screws or tads are used for the intrusion of the posterior teeth, and these as a substitute for the hypal headgear when the patient is adult or unactive. For the retention of the anterior or posterior open bite is by Howley, using of Howley retainers, and prevent the extrusion of the posterior teeth by the posterior bite plane to prevent the relapse of the anterior or posterior open bite.